Mental Maps is brought to you by Well. Well is a virtual holistic mental health service providing psychiatric evaluations, holistic interventions, and when needed, medication management. For more information, check out Well at www.arukawell.co. That's www.arukawell.co. Welcome back to Mental Maps. As always, I hope this finds you well no matter what season of life you're in. Today, I'm honored to have a guest who is walking a really interesting line in the world of medicine and theology, and I'm just excited to have him here. Dr. Benjamin Doolittle, welcome.
Hey, it's good to be here.
Man, I'm so glad to have you. Just the work that you've done, as a pastor, as a physician, as a professor, you've kind of found this way to intertwine the concepts of theology and medicine. And so I think a great place to start is, what does that even mean to integrate theology and medicine?
Well, good question. So probably it just means to be authentically human, because I think we need both. And maybe it's this modern life, frenetic, busy life that we're living that separates the two. But I don't know. It seems to me that to be a flourishing, happy human being, we have to have good medicine and good theology.
And when you say theology, just so the listeners kind of know, what are you identifying as theology, right? Kind of what is that overarching definition and what does that look like for you?
Yeah, it's a very rich landscape of joy and curiosity and humility, but I'm an ordained minister. I was ordained in the Reformed Church in America, which is a mainline Protestant Christian denomination. And I serve a United Church of Christ church. So the best way to describe that would be if you're in New England and you see a white steeple church on the green, that's probably a UCC church. And so I serve a small congregation in an urban part of New Haven. So that's the ministry side or the theology side. So I identify as Christian, I guess liberal progressive. On the medicine side, I'm an internist and a pediatrician, and I'm on the faculty here at Yale Medical School, where I have the joy of directing a residency program and the joy of directing a clinic. I also teach at the Yale Divinity School. And several years ago with a colleague, Lydia Dugdale, we started the program on medicine, spirituality, and religion. So I teach at the Divinity School. I teach a philosophy class down here at the medical school called Life Worth Living. And I teach resident doctors as they're going through their training, preaching in church on Sunday. And so, yeah.
Yeah.
That's the jam.
I like it. Yeah, man. And so when you think about that, like the theology concept in medicine and the intertwining of that, especially, coming from your background and what that looks like, how do you intertwine the two together? Is it kind of helping medicine work better? Is it guiding medication decisions? Like, what is it, a medicine in itself? Like, what does that look like?
Oof. Depends on the day, my friend. And this, when I'm on the wards or when I'm in the clinics, I'm a doc, right? I'm a doctor. And then when I'm in church, I'm the pastor. And so some days the worlds are very divergent and they feel very separate. And sometimes I think, namely around questions of suffering, doubt, angst, I cherish being at the bedside, and I cherish being in the church. I love having conversations of meaning and purpose and flourishing with residents and students, um, and colleagues, and patients. Boy, if you're sick in the hospital, you're asking deep questions. And I love being in the middle of all that. And I think spirituality or religion or theology, it's in some ways ethics is very important, right? How do you do the right thing? How do you decide what the right thing is? But I think sometimes ethics is limited in, uh, and that is, and that there are bigger questions of love and reconciliation and peace, uh, finding balance in your life. Those seem to be beyond, um, ethics.
Mm.
And so I think the language of religion, the language of spirituality can be really helpful
Yeah.
for that stuff. Um, so I think, medicine is great. I'm an apologist for medicine to the world. I mean, we live into our late 70s, our 80s because of randomized controlled trials and the reductionist approach to medicine and all that stuff, right? Vaccines and chemotherapy and interventional cardiology and the whole thing, right? We live longer because of the power of medicine and super smart people, dedicated people. So I'm grateful to be a doctor, and I think medicine does good for the world. Uh, and in the same breath, we cannot only be reductionist. And I think, nothing makes theology more relevant than being sick.
Mm.
And and one thing that we talk a lot about at the Divinity School in our class is that, um, boy, these questions of, God, meaning, purpose, forgiveness, regret, guilt, shame, those concepts, they are not idle concepts. They are not abstract intellectual concepts. If you are sick, if you have HIV, if you are struggling with addiction, if you just don't feel well, if you have back pain, depression, those questions are absolutely relevant, and you need real answers.
Mm.
And those are answers that medicine by itself often has trouble answering. And so we need a language, or we're aching. We strive to uh, find our peace with life, with
Mhm.
illness. Uh, so I love it. I think medicine keeps theology and spirituality relevant, and theology, religion, spirituality, keeps uh, medicine real.
Mm.
Uh, it asks why in medicine, and medicine asks why to theology and
Mm.
spirituality.
I love this intersection between the two. I think, like, when you look at historically, especially here in the West, when you go look back, you see where primarily like corporate religion and churches and those kind of things help kind of generate a lot of these hospital systems and all these things. And then it seems like, and I don't know what your experience is like this, but to me, it just seems like, especially over the past like 10, 15 years, and then COVID, I think really elevated it, is this in these religious spaces, there's almost this distrust to medicine for a lot of people. And it seems like it's kind of found its way into a lot of part of like corporate religion and like certain faith. I wouldn't even call them faith traditions as much as just like cultural norms within faith systems. What do you think that is, knowing that these two are so intertwined?
Yeah. Well, I think there are good reasons.
Yeah.
There are good reasons why the medical establishment, I think it's okay to you say that, the medical establishment is suspicious of religious people, and there are good reasons why the religious folks, some religious folks, not all religious folks, have great suspicion for medicine. I mean, the medical establishment, we have not been so kind to
Mm,
folks. And we in the medical establishment, I'll say we because I'm part of the medical establishment. I'm a professor at Yale, right? I'd say we have been, uh, you know, we've committed grave error in the name of science.
mm,
Um, but I also think in religion, we, and I'll say we because I'm a religious person, right? I'm a pastor of a
mm,
church. I think we in religion have had our own prideful
mm,
moments, and we cast judgment very, very quickly. Um, End of life care, vaccines. Boy, we've closed the door too quickly to these things. I've gotten very interested in some of the ancient traditions of Christianity.
mm,
And the old monks, the Celtic monks, they would talk about how God would write two books. God wrote two books. The first book is the book of scripture, and the second book is the book of nature.
mm,
And uh, and so we study the two books so that we can discern the glory of God and the joy from God. And so we read the book of scripture because it's marvelous and teaches us the ways
mm,
of God. And we study the the work of creation. We study the world because it helps us understand who God is.
mm,
Francis Collins said something like, if you discover something in the lab that nobody ever knew before, that but God always knew that. that uh, and so when we do that, when we discover something in science, it's as if the lab were a kind of cathedral. And I just love that. And I would extend that to medicine. The being at the bedside, being with a patient, is a kind of cathedral. Because how do we know God? Well, we can know God internally with our own inner life. We can know God in nature. We can know God um, in worship, but often we know God. We know the divine, the transcendent, through people,
mm.
and so we can be the hands and feet of Jesus, of God, and so there's something really beautiful about that. Um, in the same breath, it's hard, right? It's hard to show up every day and care again and again and again, especially when medicine isn't so easy.
Mhm,
I say maybe 10 times a day that the medicine is easy and everything else is hard. And by that I mean, we know stuff. We know how disease happens and we know the medicines that can fix it. But, a patient has to have faith that that medicine is going to help them. They have to have the resources to make it to the office, to the clinic. They got to believe, they have to have trust. They got to be able to make it up the stairs
mhm,
when they get discharged from the hospital.
mhm,
Some of that stuff it's not so easy. So, yeah, I've become very humble by it all.
mhm.
I'm humbled by the despair that we're seeing in the world these days, and I'm humbled by the grace and the love that people demonstrate in a million small ways.
Yeah, and I think you bring up a great point about, people, right? And ultimately, especially in the concepts of Christianity, right? Love is so paramount in so many concepts of what you're doing, and showing up and helping people is love, and then navigating suffering with people. And so one of the things I would kind of wonder, just knowing your work and what you do, does theology help give a framework for suffering?
Oh, yeah, absolutely. Um, I've been very intentional about uh, the language I'm using around, inner life, spirituality, religion, theology. I've been lumping them because each of those words are very charged, and you know, I am in a uh, East Coast intellectual institution, and so I think is common where people will say that they're spiritual but not religious, and that spirituality is this, this internal desire to seek the transcendence, and it's individualized, and that religion is connected to doctrine and tradition and institutions, and that they're separate. And that wasn't always the case, right? Like that there was a time when the spiritual people were the religious people, that the spiritual people were the monks and the nuns who practiced the enthusiastic tenets of the faith. And it was only after, the Enlightenment, maybe, certainly the 19th century religious movements where this idea of being spiritual but not religious has happened. And I think to separate the two bankrupts both, in the sense that, in the spiritual, if we say that we're spiritual but not religious, it untethers us from these rich, deep, beautiful traditions, and it leaves us, I think, spiraling unto ourselves. And because of that individualism, we lose, I think, things like worship, community. And if we separate spirituality away from religion, like I don't know anybody who says they're religious but not spiritual, right? Everyone's going to be like, "Well, I'm spiritual but not religious." But I don't know. I would round at the hospital, and I would drive 10 minutes into a rough and tumble part of New Haven, and the folks who go to the churches that I've served never talk about being spiritual but not religious, or religious but not spiritual. I feel like these religious communities, or at least the ones that I've been privileged to be a part of, that the for lack of a better word, I'm just going to call it, the presence of God is embedded in the bone marrow of the good folks in the churches I've served, and that there's a model of community, of love, a disposition of grace and forgiveness that honestly I just find so refreshing. As the years have gone on, I think maybe in my younger days I appreciated the individual journey, spiritual but not religious, and a disposition of skepticism. And I think as the years have gone on, I've been so grateful for the richness and communal glue and the joy that comes with being in community, in a church community. And, where else in my life can I go to a place where there are going to be old people and young people who are different from me? And from different backgrounds and different jobs, and some are sick and some are well, and some are rich and some are poor, and they have different different amounts of melanin in their skin, and some are even conservative and some are liberal. But we show up at this church and we're bound together by this yearning. And I just find it really beautiful. And everyone's heard about the epidemic of loneliness, and how, and I just think, hey, show up. You don't even have to, just show up. You don't have to figure it out ahead of time. Just sit there and, someone's going to welcome you. And I understand there are many religious organizations and who are judgy, and I get it. Of course, everyone has a story of how they've been maligned by church, or bored by church, or judged. But boy, I gotta think, like, I play in tennis leagues. I love to play tennis, and I love my tennis buddies. Right? I love them. They're great guys. But a tennis league is not a religious worshiping community.
Yeah.
It's just different. And I would say we need to exercise our body in community, and we need to exercise our spirit in community. you go to the gym and you think, that was great. I should do that more. I should go to the gym more. And when I, you know, walk out of church on a Sunday afternoon, I think, oh, that was really great. I got to do that some more. um, so anyway, I'm very, very interested in that. I'm very interested in like the inner life of physicians, of skeptics, I guess. We're all a little skeptical. I'm just very interested in that. Like how, you know,
Yeah, and I think,
Tim
one of
Keller
the
used.
things.
Yeah, I'm talking too much.
No,
Ask me
no,
another
you're right on the
question.
money,
What's
man. And
on
I
your
think one of
mind?
the things you brought up in that was the concept of community. And like, when you think of suffering, ultimately suffering alone is miserable. It's just like suffering without
Yeah,
meaning, right? And so ultimately, the concept of religion, right, especially like some kind of version of worship, communal worship, creates this dynamic where you can experience because we're all going to have suffering at some point. You can experience a version of suffering and have people to walk it with. And it's a different depth level compared to your tennis buddies or your gym buddies or the guys you go have dinner with after whatever that looks like. It's just a different level. And I think, I also,
yeah,
I would say I'm very similar to that. Like, never really had that until probably the past like 4 to 5 years of my life. And so getting involved in that world is so interesting, right? Because you just set with people and your own stuff. But then, as a provider, then you leave and then you go sit with other people and you sit in their stuff. And it's just a different dynamic, I think, as you think about the suffering model and what that looks like, is it does give you that ability to suffer.
yeah. There's a folk saying, and I think it's German, and so I'm not going to attempt my any German, but essentially it's shared joy is twice the joy, and shared suffering is half the suffering.
Mm, mm,
And I just believe that. And I believe it because you look at the evidence and it's just true. Shared joy is twice the joy, and shared suffering is half the suffering.
and I think, and to a point, that is medicine, right? Being able to help people find those things alone can be healing. It's just a different version of healing. And I think that there's something to be said for that, of like, what does that look like to just set, as Carl Rogers would say, just setting with someone alone is healing, and therapeutic.
Yeah.
Yeah.
Yeah. I mean, I think healing is healing is complicated, right? I understand. You got an abscess, you got to drain the abscess. You got a heart attack, you got to pop a stent in. So there's that kind of healing, and that's powerful. And I think from a theological point, I think sometimes we minimize the physical healing. I don't think we should do that. I think we have to celebrate these moments where real medical issues got fixed. Um, but we also know that healing is more than just physical. And I think you can you can be cured of the illness and still suffer the disease.
Mm, mm.
And that we in medicine are really great at fixing a lot of these medical problems. But I don't know if we're so great in fixing the spiritual
Mm.
problems. The inner turmoil that we go through.
And I think, man, that is so powerful. And I think there's probably, I mean, definitely in all the other fields of medicine, it's there. But, for me in psychiatry, I mean, it just finds its way there a lot. Maybe because sometimes our medicine isn't as great as like giving a stent for a heart, right? But then too, there seems to be a huge spiritual component for many people, if not everyone, in the concept of like mental health and mental health suffering. Maybe it's because we just can't see it. In your opinion, what does that look like as you begin to bridge those two together in a concept of medicine?
Hmm. It's a good That's a good question. If I understood your question, it's how is mental health. Can you just ask your
Yeah, oh,
question
you're
again?
good, man. Yeah. No, you're fine. So just kind of looking, you were talking about how, we can heal from illness, but sometimes you can't heal from disease in medicine. And I think there's probably no other better place that occurs at than in psychiatry, right? Primarily because many times some of our medicines aren't the greatest, right? And so it gets a bad rap.
Yeah, yeah,
Two, we
yeah.
can't see it many times, right? Unlike a heart attack or something like that, you're really working with not being able to see inside the brain when you're sitting with someone there. And so as you begin to bridge the concept of spirituality and like mental health, what does that look like from a medicine theology perspective that may even look a little bit different than some of the cut and dry sciences that we see in like cardiac and orthopedic and that kind
Sure.
of stuff?
So one of the things we read in our uh, uh, at our divinity school seminar, I co-teach this seminar with a fellow named Mark Heim, who's a theologian. We read this piece by Stanley Hauerwas called "Suffering Presence." It's been out a long time, and when I first read this book, this piece, "Suffering Presence," I was really offended because one of the things he says is that if you can worship, you are healthy. And I said, whoa, 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 whoa. What do you mean? If you can worship, you're healthy. And I was thinking, look, you could have cancer, you could have decubiti ulcers, you could have, you know, AIDS filled with, cryptococcal meningitis. Like, what are you talking about? And I think his method is to be intentionally provocative to people like me, skeptical people. Uh, and I but I've come to appreciate the wisdom from that in the sense that, and it is very provocative, and I almost feel uncomfortable, sharing this because I can see people thinking, Doolittle, you're so insensitive. But I guess, if our telos is to uh, discern, discover, worship, celebrate God, if that's what we're designed to do as a human, well, then we are fulfilling our telos and perhaps even our ultimate aim, our ultimate telos, to 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 grasp and celebrate and rejoice in the divine. And so health, in a sense, really means that. And health
Mm,
means if we can do those things, if we can yearn, worship, celebrate, enjoy God, then we're healthy, even if
mm,
we're suffering, uh, even if we're suffering. And illness is when we can't.
mm,
And so illness in the mental health world, if a person feels so depressed, so disconsolate that they can't even imagine worshiping or even imagine praying, or 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 the divine is absent to them, well, that's illness,
mm,
and that's true despair.
mm,
And so you could be driving a fancy car and have all the money in the bank and six-pack abs and uh Gucci loafers, I don't know, right? You could have all that stuff, but if if one is if you can't fulfill the yearning for the divine,
mm,
um, then that's a form of illness. So I think Stanley Hauerwas, he's provocative in that way because then it breaks down like what's health
mm.
and what's illness. Um,
That
and the Jesuits would talk about disordered appetites, right? Like you don't have to have perfect faith, you don't have to have perfect belief, but the ache is an authentic uh, act of faith, the yearning.
mm,
Um, and that at some level, faith is always a gift.
mm,
And I wish I could, it's uh, in some ways we can nurture the flame of faith and grow our sense of faith. And in other ways, faith is a mystery and it's a gift. And so I'm humble around the gift of
mm,
faith, that I'm completely appreciative of the absolutely authentic position of 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 doubt, skepticism, atheism. Like I completely get it because when you look out on the world and you consider the evidence, there's a lot to say that there is no divine. Um, but I also think if when you consider the evidence, there is,
Mhm.
and it depends on the eyes that we use to see the book of creation.
Mhm. Yeah.
So it's both very, very complicated and very, very easy at the same time, I think.
Yeah. Yeah, I love that. Yeah, and I think, when you think about those concepts of just illness being the inability to worship, right? I just think about so many people I see who they are still ill, or maybe they are still unhealthy, but they're also well, right? So you could pull their labs are messed up, everything's bad, but there's like a joy that they still hold, right? And I'm sure you see that a lot in the
Yeah,
world that you work in. I
yeah, a
see the
lot.
same thing too. And then I also see people who are just feeling it from a health perspective, right? Like you said, there's ripped, incredible health, but mentally or spiritually, they are just hurting and kind of what
Yeah,
it's like.
the tough thing about that is it's very easy to fall into this like judgmental
Uh,
place on both sides, right? Like medicine can look at the folks and see, you know, those religious folks are closed minded or, judgmental or whatever.
mhm,
And the same's true as the other way. Uh, that that the religious folks look at the left brain checkboxy reductionist scientists and see a lot of suspicion and bankruptcy of virtues. Um, when that happens, it's usually because each side is making the other side a caricature.
mhm,
And again, it comes back to like just living an authentic life.
mhm,
I honestly don't separate the two worlds much, because how do you find your peace and joy in the world? Well, you don't do spiritual stuff one minute and then do left brain scientific stuff the next minute you're just Doolittle and muddling through, I
mhm.
think. Um, yeah,
And I think that brings up a point too, something I've been thinking about for a while, and just kind of working with people and setting with people. I think one of the things that I have noticed, especially in this world of like self help and biohacking and all of the different things, is that many times what you see is a lot of these biohacking skills, right, that find its way into pop culture are ultimately ancient spiritual practices that people are just trying to remove the spiritual component to meditation, reading some kind of like affirmating psalm or parable, having a day of rest, having community, having all of these different components that they do, like people will do. And I see, and it works for a short time, but then you see where it's really hard to live out of those practices. You can live them, but live out of them when you remove the concepts of spirituality with them. And what's your thoughts on that as you kind of go
yeah.
with the
That's a
theological?
that's a very astute. It's a very astute insight. Yeah, I think the mindfulness movement. It's a great way to enter into these spiritual disciplines. Um, uh, but it does. I don't know. I don't want to be. I don't know. I've done all kinds of biohacking. I love the biohacking movement. I think it's great, right? Um, and the for the you know decades that I've tried to biohack my life, I think you're right. I think when we try to extract or distill these practices away from these deep religious practices, spiritual practices, um, they lose their flavor, I
Mm,
guess.
mm,
And it does seem like right underneath the biohacking movement, there is this like frenetic um, uh, energy behind it. Uh, and I also wonder, like in the biohacking movement, there's this idea of like, what am I going to get out of this
mm,
practice? Um, which is great. Like, right? We want to improve, right? We want to get stronger and lose weight and remember people's names and be at peace and not have the tremor. And I mean, all that stuff. That's important, right? We got to treat this gift of our body and our mind. We got to do right
mm.
by all that stuff. I don't know, the beginning of the Westminster Catechism is something like, "What is my purpose?" And it's uh, to worship God and celebrate God forever. I just enjoy that. Well, like mindfulness, if you're observing your breath and or whatever mindfulness is, but if it's not um, oriented to God, to the transcendent, I think we're missing out. And I say that not in a as a person who's figured it all out, because I certainly haven't, and I have all kinds of doubts and vexations and all of that. Um, but I just noticed in myself that it needs to be, um, oriented to the divine, to God. We just had a marvelous grand rounds today. What grand rounds is like the big lecture in the Department of Medicine, and it was a speaker who talked about the importance of compassion and how physicians who are more compassionate make fewer errors, and physicians who are more compassionate are less burned out. All these things. I was just wondering, like, where does the compassion come from? Oh, the speaker would talked about how compassion, how the importance of relationships are important to compassion, and all that is true. But I wondered what the speaker would say about the origins of compassion,
Mm,
because it's not just relationships. It's the right sort of relationships, it seems to me, is what deepens one's compassion. And I also think, you know, the idea of serving others, that was a big point of the talk, that by serving others you grow in compassion. I thought, gosh, every doctor, every nurse in this hospital spends all day long serving others. Why do half of them meet criteria for burnout and 1/4 of them meet criteria for some serious mental health issue?
mm,
So pouring yourself out for others is not by itself the way to peace and life satisfaction. I think it's more complex than that.
mhm,
And I think, um, and I just wonder, I'm thinking out loud here, when we orient ourselves only to ourselves, and this is like the mindfulness and the yoga and and the juice smoothies, and like if we're so oriented to ourself, we fold into ourselves, and it's a form of narcissism, I think,
mm,
and we become shallow, I
mm,
think. Um, but then if we're so oriented to the other, the patient, the spouse, the friend, the child, if we're so other oriented, then we lose ourselves and we become empty. And so I think there's another orientation, and I wonder, and I'm very interested in trying to translate this in a way that maybe everybody understands and or can appreciate. I feel like if we orient ourselves to God, to the divine, to the transcendent, I wonder if that's the orientation that leads to to satisfaction and joy, because then we are connected to the source that can fill our tank.
mm,
We're connected to the source that does uh, give us a sense of joy, of peace, of power. Um, I don't know. I appreciated what Augustine said, this idea of prevenient grace. And it's the idea, like over history, people will wonder about, well, you know, uh, uh, are you saved because of you said yes and you made the altar call? Is that on your will? Did you do it?
mhm,
Or the Calvinists will say, no, it's double predestination, and God saved these people. and there's nothing you did about it. Jesus saved you on the cross, and there's nothing you did. And Augustine, I mean, the guy was like 4th century, so it's been around a long time. I liked what he said about prevenient grace, that there's a seed or a kernel or a light that God puts in us. And so that's the gift, I think. And we all have that gift, I think. And that maybe by nurturing that gift, and that's where like the spiritual disciplines come in, or, you go to the gym, right? Well, you go to the gym, you get a stronger body. If you exercise the spirit, well, your spirit's going to get stronger. So I'm thoughtful about that these days.
Mm,
Um, Tim Keller would say that it's better to have a weak faith in something strong rather than a strong faith in something weak. And I've thought about that a long time. But I think he's probably right. Like I doubt, and I'm crabby and I'm judgmental and I have good days and bad days. But at the end of the day, I might have a weak faith in a God who loves me despite myself,
mm,
and a God who loves this world, even though I can't see the hand of God in every bad turn that happens.
mm.
So I think having a weak faith in something strong, at least for me anyway, seems to be the way to go.
Man, I think, gosh, it's so powerful. I want to go back to the concept because I know you've done a lot of work in the concept of burnout too, and you mentioned that and kind of talking about what just the providers there go through, and in the concept of the narcissism that can kind of go within that, and just thinking about like my own journeys in burnout and different things. you know, in our, I think one of the things that can happen is that, when we start being very scarce, we start being very fearful, we start having those mindsets, we start getting the kind of world driven, focused on those things. We then find ourselves being consumed by that. And ultimately, helping others many times doesn't get you there. And so then it leads you to feeling very frustrated at that system or at those things or the way you're delivering care. And then, you kind of run out of compassion. And so I kind of wonder, for a healthcare provider, any kind of provider, whether you're prescribing medicine or you're doing herbs or you're doing physical therapy, chiropractic, whatever, how do you find a way to bridge these together, not only in your care, but for yourself, eh,
Yeah,
to prevent that concept of that burnout that you referenced?
yeah. So I, uh, I'm, I think, well, everybody's going to be different.
Okay.
So I'll just tell you what I think works for me. I, I'm so grateful for um, my own spiritual disciplines, of which uh, I have a bunch. One of them is I gotta go to church on Sunday, because that's where I might not believe a single thing, but if I sing "Nearer, My God, to Thee, Nearer, My God, to Thee," by the end of that hymn, I'm going to think that God is nearer to Thee. you know, I so cherish my morning meditation, prayer, journaling ritual. So there is this alone time that I just am so thankful for. Um, yeah. So there are corporate practices, there are individual practices. I'm very interested in the Sabbath.
Mhm.
Um, I'm blocking on his name. Jonathan Sachs. They called him the Jewish Pope of the United Kingdom. He was like the head rabbi of England,
Mhm.
which was like this position that was appointed by, you know, the Tudor kings or something like. So this old centuries old role. He wrote this beautiful essay about the Sabbath and how if we all practice the Sabbath, the earth could rest
Mhm.
and it would reduce emissions, coal emissions,
Okay.
and that um, it would, and so it would be a way of restoring not just me or you, but it would be a way of restoring the earth. And so I started adopting that practice, the Sabbath, not in a strict way or as strict as I probably should, but things like no emails, uh, you know, no frenetic busyness. I might do some chores, but outdoorsy, yard worky chores.
Mhm.
And I think, I don't know, I think there's something to that. Like, you know, you pray every day, you worship in a corporate setting, you observe the Sabbath. Um, I don't know. I think God's going to show up in the middle of that somewhere.
Man,
Um,
yeah, you bring up a really,
and or the divine or the transcendent,
yeah,
or one thing that this is a little bit of a tangent, but the thing that um I, I'm very thoughtful. Like, one reasonable critique of religion is that we in religion, we can be very judgy, and I think Christianity has like two rails. On one rail is on one, and by rail meaning like guardrails. Like, on one rail is like the the judgmental side of who's going to heaven, who's going to hell, who's saved, who's a sinner, like all that kind of stuff. And people are writing about that, and they're saying mean things about gay people, or the Republicans, or the Democrats, or whatever, right? Like, there's the judgy, who's in, who's out kind of dialogue. And I also understand that the critique of the liberals will say, "Oh, well, if everybody's saved, well, like, why do anything? Like, moral relativism, that's crazy too." And so, you know, I think that um, what we got is we got the Beatitudes. Like, I'm going to go with the Beatitudes, uh, which is, blessed are the peacemakers, for they shall inherit the earth. And I feel like Christianity, when you really read the book, the book of scripture, you get this like sense of balance, that there is this intellectual integrity and spiritual integrity, and that harmonizes. And we do our best to pull it apart or turn it into controversy, but you know the Beatitudes, right, is gives us enough of a guardrail, I guess, or gives us enough to live by, to fulfill our telos,
mhm,
to fulfill our purpose, which is to celebrate, worship, discover, enjoy the transcendent, enjoy God. And part of that is to do the best you can, do good,
mhm,
right? And medicine is a great discipline for this. Medicine, we do good, right? We seek to heal the sick. And in fact, um, medicine looks a lot like a religion. We have a priesthood, right? Attending physicians, fellows, residents, students, right? We have a hierarchy that looks very religious. Grand rounds looks a lot like worship. We gather in an amphitheater, and an esteemed high priest gives us a, a, a sermon, a talk.
mhm,
Um, we have sacred writ, the New England Journal of Medicine, JAMA. I mean, these are the canons upon which we live our lives, and we do good. We're trying to stomp out disease, and we in healthcare, for the most part, still have the respect of society. Our parents are proud of us because we're doctors or nurse practitioners or nurses or whatever, and so medicine checks a lot of boxes where it looks a lot like religion. Uh, but where medicine collapses upon itself is precisely the moment when we need a true religion, when we need
mm,
a sense of grace and
mhm,
rescue and
mm,
reconciliation and peace. Um, and so medicine cannot replace religion, as hard as we try.
Mm. Man, there's so many concepts. We could just riff on just all these concepts for hours, right? I love the concept that you brought in about balance. And ultimately that that is that is health, right? It is a version of balance, this allostasis, this ability to respond to the things that occur, and that you have this balance that happens, and ultimately, whether it's religious practices or it's medicine or whatever kind of type of medicine kind of concept that we have, it's all attempting to restore balance, for people, many times. And I think that's something that we lose track of sometimes as providers, is that we have like a set of tools, and we're using those tools, and it can restore a version of a balance. But sometimes if we don't bring in those other concepts like you're talking about, we pull the scale too far one way, and we lose track of how are you spending your time when you're not in my office? What are you doing, when you're not taking your medicine? What does life look like? What are you consuming? What is, all these other concepts. And so I like how you brought that in, that, we can give all these tools and all these concepts in whatever field that we're in, because you're right. Many fields, I think, are like that. We all, because ultimately it's how you create things, right? Like we have these like, hierarchies and what that looks like, for people, like, let's say like you're not a healer, right? Like you're a person that is just navigating the world. How do you integrate spirituality with attempting to find healing in whatever way that is, right? I know you talked about the practices, and I think the practices are incredible, right? Like the work of, John Mark Comer and the Practicing the Way team out in California and Portland and some of those areas where, they're generating these practices and helping people do them. And I think that is really awesome, and being able to figure that out. Like my wife and I, we've been trying to Sabbath for couple years now. We've been kind of on that rhythm of doing that, and it's so filling when you do it in a way that's filling, and you can rest, and everybody rests differently, and all the concepts. But I do wonder, how can people who are hurting find healing as they navigate these Western medicine models, but also find like, that theology healing, the spiritual healing.
Yeah, that's a good question. I mean, that is the question. So probably it looks differently for everybody. And I wonder if I think we have to show up. Right? You got to show up. And that means showing up to see your healthcare provider. It means showing up to ask the big questions to the Almighty. I think it means to show up. Uh, and I think, boy, we're always a little broken, aren't we? Even when it seems like we're strong, or from the outside, we might say, "Oh, they got it all figured out." I don't know, I'm very struck. I mean, I'm on the faculty at an esteemed medical school, and with super talented, smart, successful people. Um, but I've also been very um, humbled that even the super strong, talented folks will share that they're grieving in their own way as well. So I'm 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 sensitive to that, or at least mindful of that. Uh, that we're all a little broken, and we're all trying to figure out as we go, I think. Um,
Mm, mm. Yeah,
yeah.
as you're saying that, something that came to me, just hearing that is, if you're navigating these systems, trying to find healing, remembering that those people who are also trying to help you are also carrying their own things. And I think sometimes it's easy to forget that maybe that you showed up and you didn't get the answer that day. Those people care too. Those people who are trying to help you are trying to care too. And so being able to remember that, as you navigate those systems is important, because I think that's how you get those really strict divides of like, this is bad and that's terrible, and different things, is because ultimately you think that they're going to have all your answers, and then none of us have all the answers. And I think that can be very hard for people sometimes.
Yeah. When I was a med student, I was the pastor of a small church of a urban congregation that didn't have a lot of money, and I was the last ditch person because I was a med student, and I would write the sermons on the hospital note paper. This was back before the electronic medical record, and I would kind of sit in the nurse's station to be involved, but also scribbling notes for the Sunday sermon. And one day my attending, so my supervising doctor, came up to me and he said, "Well, what are you doing?" I'm like, "Well, I got to preach tomorrow." It's like, and he said, "Doctors are the priests of today." And this was many, many years
Mhm.
ago. Doctors are the priests of today. And I think he said it as a jibe a little bit, like, intentionally provocative. Here it is all these decades later, and I'm telling the story because I'm still thinking about it.
Mhm.
Because people do go to their doctor as if they would go to a priest. And maybe that's the problem,
Mhm.
uh, that you go to a doctor and you feel guilty and sad. And what do you say? You have headaches, you're drained of energy, you have chest pain, you have, and then the consequences of all of that angst and anxiety is the blood pressure and all that stuff. So I think in some ways priests are or physicians are the priests of today, and that's sad. And that's because we physicians don't have the architecture to address the spiritual suffering that we're all going through. We're okay doing medicine, but it's hard to do the other stuff.
Yeah.
Um, and so, I mean, and I'm speaking from the perspective of, liberal progressive pastor in New England who's the faculty of an Ivy League institution, right? That it might look different in other parts of the world or other parts of the country. Um, so anyway,
Yeah, and I think you do
this
see
idea
that
of
in so
physicians as priests
yeah.
is it's just very a provocative
Yeah.
um, idea.
Yeah, and I think you're right on the money. It has so much to do with culture and all those other concepts. And you do see, especially in the world of mental health, if you get into other parts of the world, right? Like you'll see where there's the medicinal healer, the spiritual healer, and a lot of people end up over in the spiritual healer for the mental health concept, but they also need the medical stuff, and it's like vice versa. But we can't have it all together. But I think it goes back to what you said of balance, and I think that's the main thing. Like I take from this is that ultimately as you intertwine these together, they ultimately can't be separated because it's all one big balance. Healing is a balance, health is a balance, illness, and illness is ultimately being out of balance, right? And so I think, no matter where you fall as you listen to this discussion, man, trying to find balance and being open to whatever avenues can lead you to this holistic integrative healing, but making sure you're addressing all of these concepts, right? It's not just the biology, it's not just the psychology, it's not just the spirituality, it's kind of everything, but also, it's just this intertwining of it. So, for you, Ben, I know you have a lot of different work going on. You have a book coming out soon as you begin to bridge these two together. For the listeners, how can they find this? What does that look like?
Oh,
When is it coming out, man?
oh, hey, thanks for plugging the book. I was So this is a book called Theology and Medicine: How the Healing Happens. And um, this book was inspired by the curriculum of the class that Professor Markheim and I teach at the Divinity School. So we've been teaching this really great graduate seminar called Theology and Medicine at the Divinity School. And over the years, it's been just a really popular class. And we get people from across the university, undergraduates, nursing school, public health, forestry, everybody comes. And it's a great class. And then we realized, hey, we should turn this class into a book. So we did. And so it's coming out in March. And you just put our name in it. Doolittle, don't forget the second O. uh, Markheim, Heim, and you can just plug it in. How the Theology and Medicine, how the healing happens, and it's coming out. And yeah, I'm so thankful that that Mark, Mark was a great colleague and mentor. He's written a lot of books, and so he and I did it together. But um, it was really it was just a joy to do this with my good friend and mentor and colleague.
That's awesome.
So it's coming out in March. Yeah, great.
Right on. Yes, and we'll definitely post a small link there in the show notes as well. You kind of check that out. I think that'll be really interesting. Just continuing this conversation on the intertwining of all these really complex concepts as we as all of us humans try to figure this out, right? And try to help people feel as well as they possibly can feel on this earth. And I think that's huge. Ben, one of the things that you already mentioned is kind of some of the stuff you do. I always ask people who are on the show, what's maybe one thing that you find yourself doing right now for your mental health that you find really important?
Oh, so um, several years ago, I read the book The Artist's Way by Julia Cameron about how to live a more creative life. And one of the things she says to do is to write 3 pages a day. She calls it her morning pages. And I adopted that practice, and I call it my Renaissance journal. And so, and then in the spirit of modern biohacking, it was very easy to stack on prayer, meditation, stretching, all this great stuff. Um, so the one piece of the day that I'm just so thankful for is this habit that I feel is like just a gift. It's the first thing I do. Is I write and think and pray, and sometimes I just stare out the window. Sometimes I was staring out the window and I thought, "Hey, wait, I'm doing mindfulness. I didn't even know I was doing mindfulness." So I'm thankful for that practice. I mean, I feel like some of these spiritual disciplines are like the architecture upon which we build um, our temple. Build the structure by which we live our lives. And so I'm very, very thankful for that moment in the morning of prayer, reflection, journaling, all of it. So that's the one piece that a
Mm,
lot flows from that, I think.
I love it. That's awesome. So for people who are looking for stuff, that's a great idea. I like it. Ben, thank you so much for being here, man. Thank you for so much your wisdom. Thank you for the work that you're doing. I think there's some really cool components in this, man. Man, just so grateful. Thank you.
Thank you.